Hi, I'm Dr. Mark Landrum. I'm the Medical Director for Hospital Epidemiology and Infection Prevention here at Howard County General Hospital. In addition, I'm an infectious disease physician and I've been practicing here for 17 years. Part of my role is to make sure that we have a safe environment for you as a patient, any visitors, medical staff, and medical staff services throughout the hospital. The COVID-19 pandemic has forced us to delay some surgical services, and we're excited to show you the changes we've made to provide a safe environment as you come back. Here's what you can expect if your surgery has been scheduled at Howard County General Hospital. We take infection prevention very seriously, and our medical staff follows guidance from the CDC and Johns Hopkins Medicine infection control specialists. Our staff is screened daily for COVID, and we all wear personal protective equipment like face shields and masks. We also practice proper hand hygiene during your visit. Every outpatient and inpatient is tested for COVID-19, even if they do not have symptoms. We maintain strict cleaning standards by disinfecting rooms and equipment between each patient. Prior to your surgery, we will ask you about your health and potential exposure to screen for COVID-19. All patients requiring surgery will be tested for COVID-19 within 72 hours before the date of surgery. Drive-through testing is available through Johns Hopkins facilities. If you develop symptoms, please call ahead and your physician will advise on next steps. On the day of your surgery, you will park in the hospital visitor parking and call the phone number provided by our staff when you arrive. To minimize the number of people in the waiting room, we will do registration over the phone and only a brief check-in when you come inside. Once we tell you to come in, go through the Berman Pavilion entrance pictured here. This is our outpatient surgery center, located right next to the hospital. A member of our team will screen you at the door. For everyone's safety, any patients with COVID-19 in the hospital are kept isolated from other patients. We will ask you to bring a mask. If you don't have one, a mask will be provided for you to wear while in the hospital until your surgery begins. One visitor or family member may accompany you to the waiting area, but once you go into the preoperative area, they must wait in their car or outside while your procedure is completed. When you are ready to leave, we will safely escort you to the care of the person taking you home. The driver must wear a mask. A nurse will accompany you out to your car and will review discharge instructions. We want you to be safe, but we also want you to feel safe at our hospital. If you have concerns at any time, stop, ask your doctor. We thank you for choosing Howard County General Hospital for your health care, and we wish you a safe and speedy recovery from surgery.